Today, let's talk about heart failure pharmacological treatments and outcomes in heart failure with mildly reduced ejection fraction. Guideline recommendations for the treatment of heart failure with mildly reduced ejection fraction derive from small subgroups in post-hoc analysis of randomized trials. The objective of this study was to investigate predictors of renin-angiotensin system inhibitors or angiotensin receptor neprilysin inhibitors and beta blocker use, and the association between these medications and mortality or morbidity in a large real-world cohort with heart failure with mildly reduced ejection fraction. Coming to the methods, the associations between medications and cardiovascular mortality or HF hospitalization and all-cause mortality were assessed through Cox regression in a 1:1 propensity score matched cohort. A positive control analysis was performed in patients with EF less than 40%, while a negative control outcome analysis had cancer-related hospitalization as endpoint. Coming to the results, 421 patients with heart failure with mildly reduced ejection fraction, 84% received RAS inhibitors or ARNI and 88% beta blockers. Shared independent predictors of RAS inhibitor or ARNI and beta blockers use were younger age, being an outpatient follow-up in specialty care hypertension. In the matched cohorts, use of both RAS inhibitor or ARNI and beta blocker use was separately associated with lower risk of cardiovascular mortality or HFH and all-cause mortality. Results were consistent at the positive control analysis, and there was no association between treatment use and the negative control outcome. To conclude, renin-angiotensin system inhibitor or angiotensin receptor neprilysin inhibitors and beta blockers were extensively useful in the large real-world cohort with heart failure with mildly reduced ejection fraction. Their use was safe since associated with lower mortality and morbidity. The findings confirm in the real-world evidence from previous post-hoc analysis of trials and represent a further call for implementing guideline recommendations.